To allow the stomach to heal correctly after surgery, patients need to ease their way back into eating solid foods. Design a detailed eating plan that includes schedules, portion control, and that is tailored to your patient's needs. Clinical preferences and practices vary, so there are a variety of postoperative diet progressions. The following 2 plans have been used with success. Feel free to customize them as you see fit. They are addressing the patient directly. Long progression to solid foods. First 2 days after surgery, drink water or clear liquids and suck on ice chips. Day 3 through day 7, keep a liquid diet of protein meal replacement liquid shakes, chicken, beef, or vegetable broth, none with cream, skim milk, no sugar added fruit juice, sugar-free frozen fruit juice on a stick, and water. Day 8 through 21, eat smooth pureed protein such as fish or chicken, pureed vegetables, fruit smoothies, hummus, egg salad, cottage cheese, pureed soup, gelatin, baby food, mashed potatoes, applesauce, and low-fat yogurt or pudding. Drink liquids, especially water, and any other zero-calorie liquids such as tea. Day 22 through day 42, add soft foods like fish or ground turkey. Shorter progression to solid foods. Week 1, liquids only. Include protein shakes, broth, anything or any texture that would go up through a straw without actually using a straw. Week 2, add smooth pureed protein such as fish or chicken, pureed vegetables, fruit smoothies, hummus, egg salad, cottage cheese, pureed soup, gelatin, baby food, mashed potatoes, applesauce, and low-fat yogurt or pudding. Week 3, introduce solid foods like fish or ground turkey. Slower transition option. Some programs have patients remain on liquids for 2 weeks post-op, then transition to solid foods within a few days. Patients have to be made aware that eating will be different with a band, especially early on when they get used to things. For instance, they need to be aware that dry meats and bread may be challenging. Life in eating with a band is different. After choosing a progression, expand on the appropriate foods and drinks your patient should consume and how they should consume them. For instance, they may drink as much zero-calorie liquids as they wish. Drinking with meals was thought to be bad. However, as we understand better how the band works, primarily by reducing hunger and not by restriction, research data and clinical experience suggests that it is okay for band patients to sip liquids with their meals. Keep in mind that countless patients have lived with the no liquids with meals rule. This worked for most. New patients may be more interested in the band if less rules and obstacles are presented. Sipping liquids with meals is more appealing than never being able to drink with a meal, and the satiety mechanism is not negatively affected. Once you begin to add foods that require chewing, explain to your patients how to cut their food into small pieces and chew foods well enough for their new stomach opening to accommodate. Eating with a band is different than eating without a band. Eating slowly is very important, but not eating too slowly. A meal should last 20 to 30 minutes. This will be described in detail in the following section. Stress to your patient how his or her meal plan must become routine. From now on, they'll eat less food than they were used to eating before surgery and eat a healthier, more balanced meal plan. Because a well-adjusted band will reduce hunger, it'll help them follow this plan. But in the end, it is their commitment to their new eating habits that will determine how much weight they will lose. Let's review some guidelines for the diets to follow beginning week 4 after surgery as you add soft foods and then foods that require chewing to your patient's dietary plan. Please share them with your patients. They are collected from many patients that were successful at transforming their lives. Month 2, 8 tips for success. Eat only when you are hungry. Eat slowly. Stop eating when you feel satisfied. This is key for decreasing esophageal pouch stretching. This is a feeling that is learned over time. Be active. Do not eat between meals. Eat high-quality, nutrient-dense food. Drink low or zero-calorie liquids. Stay on top of your aftercare.
Tip number 1, eat only when you're hungry. About 3 small meals a day with 1 protein snack that's healthy. The lap band system creates a small stomach pouch that can hold only 1/4 cup or approximately 2 ounces of food. If your patient tries to eat more than this at one time, they may become nauseated and vomit. If they routinely eat too much, the small stomach pouch may stretch. That will cancel out the effect of the band. Frequent vomiting can also cause certain complications, such as stomach slippage. Your patients need to learn how much their stomach pouch can hold comfortably and not exceed that amount. Find a range that is comfortable for them. If patients master the next behavior, eating slowly, then food will not be sitting in their pouch and they will avoid overfilling and stretching their pouch. Tip number 2, eat slowly and chew very well. Food can pass through the new stomach opening only if it has been chewed into very small pieces. Always educate your patients to take more time for their meals and chew their food very well. The following eating instructions should be taught, reviewed, and reminded at every visit. Eat slowly. This is the most important of all rules. We don't do this naturally, and it is difficult. It requires concentration and training. First, chew well until no lumps. Then swallow and wait. Allow 1 minute from one swallow to the next. 1 minute is a long time. Passage of each bite across the band takes this long. Each meal should last 20 to 30 minutes. That's only 20 to 30 bites. This change in behavior is the hardest and most important change lap band patients need to make. Small, well-chewed bites will pass through a well-adjusted band in about a minute. Eating faster can result in discomfort and distension of the stomach pouch above the band. Esophageal waves, or peristalsis, push food down through the esophagus and through the band. Allowing time for each bite to collect and clear is very important. It can take 2 to 6 peristaltic waves to complete the transition of one small bite through the band junction and into the stomach below. The pressure applied by the band on the stomach tissue as food transitions through the area of the band provides stimulation on the nerve endings. These send messages back to the hunger centers in the brain that may be responsible for resulting reduction in hunger with small volumes of food. Being too tight and eating too fast can result in complications, discomfort, and ultimately failure of therapy. If patients don't follow this advice, they may experience food obstruction, stomach irritation, and vomiting. This can cause the stomach pouch to expand, increase the chance of stomach tissue slipping up through the band, or increase the chances of band slippage out of place. If solid foods cause nausea and vomiting, it can be necessary for the patient to go back to a softer liquid diet. If this does not resolve the symptoms when the patient advances back to a solid foods, fluid may need to be removed from the band. Tip number 3, stop eating as soon as you feel satisfied. When you no longer feel hungry, stop eating. Since a small amount of food may satisfy, it's important to start with protein. Do not wait for a stuffed feeling to stop eating. Doing so, your patients are ensuring that they are getting in the proper fuel. It takes time, though, for them to become aware of this no longer hungry signal. So they need to space out their bites, 1 minute between bites. If they rush through their meal, they may become uncomfortable as the pouch may become overfilled, and they may eat more than they need. This leads to nausea and vomiting. Teach your patients to take time and enjoy their food, but not a long time. They should take about 20 to 30 minutes to eat. They want to feel satiated, not stuffed or uncomfortable. Tell them to try to recognize that feeling of no longer being hungry before they feel uncomfortably full. Tell them to recognize the feeling of fullness and then to put down their utensils. Tip number 4, be active. Tell your patients that this rule is important. Physical activity burns calories and is important to successful weight loss maintenance. They shouldn't be intimidated by strenuous exercise regimens. As we saw earlier, lots of simple daily activities that are calorie burning activities can be rewarding and even fun. Tip number 5, do not eat between meals. Stress to your patients that after a meal, they should not eat anything else until the next meal. Eating snacks between meals is one of the major reasons for weight loss failure. It is very important to break this habit. Patients with proper fill levels do not feel hungry in between meals. If they do, this may be a sign that their lap band system is too loose and they should tell their clinician. If they're going to break this rule, they should choose raw vegetables, a few almonds, or nuts. This is reality. Teach your patients how to plan and prepare small, healthy snacks to avoid weight gain and possibly prevent emergency band adjustments due to bad choices eaten too fast. Tip number 6, eat only high quality foods. Meals should be high in protein and vitamins. Patients should not fill their small stomach pouch with junk food that lacks vitamins and other important nutrients. Teach them how to avoid foods high in fat, sugar. Instead, fresh vegetables and fruit. Not fruit juice though. Meats and whole grain cereals. Discuss if they should add any vitamins or supplements to their diet. Remind them that food is for fuel, not pleasure, comfort, boredom, or habit. Tip number 7, drink only 0 or low calorie liquids. Drinks, including those containing calories, simply run through the narrow outlet created by the band. If patients drink high calorie liquids, even healthy ones like fruit juices, they may not lose weight, even if they otherwise follow the diet you designed for them. Tip number 8, stay on top of the aftercare. Aftercare is essential to success. Work with patients so they remain in contact with you and engage in their weight loss program.